Good morning, everyone. My name is Emily Smith. Today, I'll be presenting my explanation of the pathogenesis causing the clinical manifestations which the patient, Mr. D'Souza, presents in the case study. Mr. D'Souza is 83 years old. He was brought in by ambulance after a pre-syncopal episode at his GP. He presented with increasing malaise and a painful swollen knee. John has a history of rheumatoid arthritis, which he's had since he was 18 years old. After examining Mr. D'Souza, the following observations were made. His right knee is swollen, hot to touch, red and painful. His pain was scored 8 out of 10. He has a limited range of motion of the right knee. He's febrile. His temperature is 38.7 degrees. His blood pressure is 90/50. His respiratory rate is 22 breaths per minute. His heart rate is 120 breaths per minute. He has deformities of proximal interphalangeal joints and metacarpophalangeal joints and wrist. A provisional diagnosis of septic arthritis of the right knee has been made based on these observations. So, septic arthritis is a painful infection in a joint, usually the knee, shoulder, or hip. The main causative agents are Staphylococcus aureus, Group A Streptococcus, and Neisseria gonorrhea. The pathogenesis of septic arthritis is bacteria invading the synovial joint. The route by which this occurs is demonstrated on this diagram. So the hematogenous route, which can happen if you have a tooth infection, respiratory tract infection, or gonorrhea. It's basically spread via the bloodstream. Osteomyelitis, so infection of the bone marrow, also caused by staph. An infection on the surrounding tissue outside of the joint, e.g. staph. You can acquire septic arthritis after a procedure or surgery, demonstrated here, or by direct trauma to the joint. So, for example, an animal bite. Once the bacteria have infiltrated the joint, this triggers an acute inflammatory response. This is the pathogenesis of septic arthritis, or how one would acquire septic arthritis. So the clinical manifestations of septic arthritis are pain, decreased joint mobility, the joint becomes hot to touch, erythema, which is redness on the joint, swollen joint, or temperature. So in relation to the case study, you can see that Mr. D'Souza is experiencing all of those manifestations. One resource that I found particularly helpful in summarising the pathogenesis of septic arthritis is this flowchart by the Calvary Guide to Understanding Disease. For the purpose of this assessment, I'll talk about the pathophysiology relevant to Mr. D'Souza. So, as discussed in the case study, Mr. D'Souza has a history of rheumatoid arthritis, which is a pre-existing joint pathology, which leads to an increased risk of intra-articular bacterial colonization within the joint. Once the joint becomes infected, the acute inflammatory response begins. This inflammatory response causes fever, which is one of the main clinical manifestations experienced by Mr. D'Souza. So Mr. D'Souza is febrile. His temperature is 38.7 degrees. This is a result of an acute inflammatory response to the exogenous pyrogens that are invading the synovial fluid in his affected knee joint. The body produces endogenous pyrogens, cytokines, which inhibit the production of heat-sensing neurons in the hypothalamus, which ultimately causes the rise in the body's core temperature. These cytokines also activate B cells and T lymphocytes, which play a crucial role in the body's immune response. The rise in temperature facilitates the production of disease-fighting white blood cells and creates a hostile environment to inhibit bacteria growth. So, as a result of the immune response that's been triggered, not only is there an infiltration of cells into the joint, hyperemia in the synovial membrane also occurs. Consequently, there is an increase in synovial fluid in the affected, and the affected joint becomes swollen. As a result of this swelling, erythema and warmth on the site of infection that John is experiencing becomes evident. It is also the cause of the decrease in joint mobility. The increase of fluid in the joint increases the intra-articular pressure in the synovial joint capsule. This obviously causes pain, as experienced by Mr. D'Souza, who rated his pain 8 out of 10. So in conclusion, the clinical manifestations Mr. D'Souza is experiencing is consistent with the pathogenesis of septic arthritis. The pathophysiology of septic arthritis is considered a medical emergency and requires immediate medical treatment. Failure to treat will lead to permanent joint damage and can lead to death. Mr. D'Souza should undergo therapy as soon as possible. Thank you for listening to my presentation.